Hi, my name is Jordan Schroeder. I'm a student at Life University, originally from Georgia, and I, like many other of my female friends I know, have always suffered from menstrual cramps. And every month I would basically just plan it to happen, and I'd have to stop my life and make my plans around it, and it would basically either throw me in bed for a few days or interfere with my plans that I had that night. Really inconvenient and really painful. My low back would start hurting. I would feel very emotional a couple of days before, and all these things are so common that a lot of girls, including myself, just lived with it and thought it was normal and something that we had to deal with, part of being a woman. And so I now realize to this day, after having met Dr. Ellis, I found him through the program. He's a teacher and an amazing doctor, and I had the pleasure of being an intern at his office. And one day, that 28th day, it hit me, and I was in the office, and I was pretty much like, okay, I gotta get out of here. Stuff's happening, and I'm not gonna be useful, and I gotta go home and get in bed, basically, with the heating pad, ibuprofen, the whole works. And so he was like, just wait just a second. He's like, come back here, come in this room, and let me just take a look at something. I was like, okay, you can try, but it's not gonna work. And so I tried everything, I thought. And so I just laid down on the table. He did some soft tissue work on my abdomen and was actually working with the structures around my uterus. And the cramps went away immediately. They were probably, I would rate them at like a 8 or 9 out of 10. They're really bad at this point. And so they was like, don't move your hands. Like, it felt so good. They were gone. And so he's like, well, they should stay gone. So finished the maneuver, and then I got up and I moved around and I ate something, and I was like, okay, when are they gonna come back? And they never did. They stayed gone. They came back to like a 1 or 2 out of 10, and he did the maneuver again and then completely gone. And not only were they completely gone, but I really felt amazing the rest of the day. I was able to finish seeing patients, observing him, and it blew my mind. I was just shocked. And so then I asked him, I was like, okay, is this something that I'm gonna need to come back for next month? And he was like, this should help you in general, but we'll see. You can always come back. So next month, it happened again, and I didn't even, nothing. It was like no cramps, nothing. Everything was great. And I even felt a little more emotionally stable. And so I was shocked. I texted him. I was like, there's no cramps, they're gone. It's been this is something I've dealt with for about 12, 13 years now. And so, and it was getting worse actually. So now I do not deal with that anymore. And I had to restructure everything. I can just go about my life and not worry about it and not have to change plans for it. And most of all, not think that it's normal. I've been helping other women with the same issue actually. I've helped several of my girlfriends with the same technique. And so he loves that I'm passing it forward. And I hope that I can pass that message along to women that this is not something we have to deal with, and a maneuver like this could keep you from having to suffer from it the rest of your life as well, or until menopause. And so I would highly recommend a visit to Dr. Ellis's if you are suffering from anything similar, and trust me, I don't even have to say you will thank me later, because your life will be better and you'll enjoy it as much as I have.